COVID-19 quarantine is to be stopped with immediate effect. This applies to both vaccinated and unvaccinated contacts. This is contained in a statement released by the Department of Health this morning titled Revision to Contact Tracing, Quarantining and Isolation Protocols. The statement says the revisions have been accepted based on COVID-19 advisories. Contact tracing will also be stopped with immediate effect except where there is a cluster outbreak. The Deputy Minister of Health is Dr. Sibongiseni Dhlomo. He joins us now via Zoom. Deputy Minister, thank you so much for making the time to speak to us this morning.
Good day, Ms. Desiree, and good day to your viewers.
We don't have a great connection, but we'll make the best effort. Please confirm to us that instruction to stop contact tracing, quarantine and isolation protocols with immediate effect announced in the statement.
Yes, I'm here to confirm that the statement released by the Minister today is actually to that effect, based on the advice that we received from our scientists, that it is really not having any impact anymore. Quite a lot of people who are both vaccinated and unvaccinated during this period are actually not symptomatic. So you probably never know when to do that. You get one person infected, but you just cannot get, unless it was in a cluster as we are referring. So we have since stopped all those contact tracing as of today.
These revisions are such a massive game changer from when we first went on lockdown and protocols were introduced. Just take us through some of the advice that you got that led to this decision.
You watch the epidemiology of the disease and the way it is actually unfolding. Currently, you do notice that while we are pushing quite a lot of our people to continue to be vaccinated, we are very happy that we are sitting with about 66% of our senior citizens, that is 60 and above, vaccinated. The 50 to 59 that are vaccinated is sitting at 63%. So that what was defined earlier on as the high-risk groups of our people are now vaccinated to about, out of 10, 6 people are vaccinated. So that's a good story to tell. Then secondly, when you look into this current Omicron variant, yes, we have seen an upsurge in terms of infections, but a significant number of our people, firstly, those who are in hospitals are 70% unvaccinated, and only 30% are vaccinated. And all of them do not go to really ICU or die. So while we're seeing an upsurge in terms of infections, we are not seeing a significant number of ICU admissions and deaths. And therefore, quite a lot of other people who get infected, you trace the people who are around them, they remain asymptomatic. So we're not really seeing a severity of that. And therefore, because our scientists have been watching the space, they are advising us that now, probably due to previous infections or the vaccinations, all of us are at least 70% protected against this virus. Therefore, look, there's no need to really push some of these measures like contact tracing and all that. So we have since stopped that. That is the science that they are advising us on.
Let's just unpack the statement on these changes and exactly what changes are going to take place going forward. I know it's quite a lengthy one, so I won't be able to go through everything. But one of the things it says is the proportion of people with some immunity from infection is high, putting it at 60 to 80% in some sero surveys. What does this mean?
Desiree, if you walk about there and you are vaccinated, or we have had the previous COVID-19 infections, that puts you on, in fact, that puts you on to be 70% protected against COVID-19. Now, I know, and you probably also have picked this up, that what is a new variant, an Omicron or whatever, Delta, it's just a sister or a brother to what exactly we're experiencing. So part of the remnants of the current whatever that infects you as COVID-19 has some semblance with the previous variant as a family, and therefore you are almost protected. Yes, there may as well be some of the things that we call immune escape. There may be some of the particles of that new variant that may just give you a bit of a challenge. But overall, by vaccination or from previous infections, you are almost 60 to 80% protected against any new strain or any new reinfection.
It also says containment strategies are no longer appropriate. Mitigation is only viable strategies. Unpack this for us.
Yeah, so what we are actually now calling for, that is like an opening statement of all these mitigating factors. Therefore, what are we then mitigating? That we're moving away from asymptomatic. We are now seeing what we could call an asymptomatic disease. Therefore, we will move away from actually do the contact tracing. We are actually having a high degree of asymptomatic presentation of this disease, and there are very small cases that are actually being diagnosed, and therefore those are what we then put in, those measures that we had put in place, those strategies are now refocused into being mitigating factors and strategies.
So we previously used to talk about asymptomatic people still being infectious. Are we saying now that they're not necessarily infectious?
We are actually saying that they are also, yes, they are actually may be still be infectious, but we are saying the previous vaccinated and previously infected persons are 70%, almost 70% protected against that. So even if they spread to me, to you, I am covered in terms of that. The disease may not be virulent to me as if it is coming to a new stranger, a person who has never been infected before. If you infect me, Desiree, today, and I'm previously vaccinated or I have been infected before, I may just get a mild inconvenience of a flu for 2-3 days. That is what we see. In fact, most of the admissions, they never stay more than 4 days in the hospital. And some of them we say are incidental findings. A mother or a child has gone to hospital for a headache or something else, and then because there's been doing this testing on all those admissions, then they pick up that, Desiree is asymptomatic for COVID, but the diabetes we are coming to control, therefore let's treat this diabetes, but we are picking up that she is positive, asymptomatic. So there's a story that is being put together by clinicians and scientists.
We're speaking about the scientific picture. How do we translate this into real life, Deputy Minister, especially at a time like this, where crowds will be gathering in churches, at beaches, and the likes? How do we translate this information into real life?
I'm just following on the very important speech by the Deputy President, where we are still saying, we are far from ever saying, let's stop using masks. We are far from saying we are not going to adhere to non-pharmaceutical protocols of sanitizing, washing hands, and actually social distancing. The statements that this is what we are bringing up now does not nullify what has been there before. The President, Deputy President have said before, if you are actually going to be inviting family for big gatherings, you're much safer to adhere to these non-pharmaceutical protocols. But again, if you can do so, why don't you have it outdoor? Sit out there in the veranda in an open air, and that is also going to be improving those. So what we are doing, because falling short of lockdown, which the country, we are very grateful it didn't do, is to add measures to say, yes, Desiree will come, symptomatic or maybe asymptomatic, infect you, but if you're in an open space, open air, very unlikely that you'll be infected. But even if you do, it will still be a very mild asymptomatic disease to you. So that is what the scientists and what we are actually combining here in this picture.
What protocols will replace the scrapping of these 3 protocols?
Replacing which ones?
The ones that are being scrapped about quarantining and the likes.
Look, what we have in place is to say, let's halt those ones now, because their effect, their impact is not there anymore. And we are actually seeing this type of an illness, which is actually causing mild disease, which actually has got a high number of South Africans who are now vaccinated, and that vaccination or the previous infection protects you. So we're not replacing, but we are saying remove them and adhere to this one. We still are actually saying if you are symptomatic and you are actually having an illness, you will still be quarantined. You will still be having that part of, you will still be isolated. So that part, but asymptomatic, which is a large number of South Africans, that one has been relaxed.
As we prepare to let you go, one of the things that I mentioned in the statement is new knowledge about the virus. Are there any new insights that you have for the South African public, Deputy Minister?
Look, this is ever revolving. Every day we learn something new. We actually now, that is why, again, I'm sure you also have picked this up. Today also we are starting vaccinating or giving boosters to South Africans who were given a J&J from the 24th of October backwards, because they've actually finished that time. So 2 months after you have been given a J&J, you now can be given a booster. There's a new information that is coming into place today. And on the Pfizer, there's a 6 months period. So if there was a senior citizen who was given a vaccination, because we started the rollout for the senior citizens on the 17th of May, and then we probably followed religiously on the 28th of June, you went for your booster, for your second dose of Pfizer, which is a 42-day. Now you are eligible for a booster on the 28th of December, which is a 6 months period. That is with effect this month. And today we announced it that we are starting with the J&J boosters. You will probably know that we have already started with the boosters for our healthcare workers. So we are calling upon our teachers, SAPS, SNDF, and all those who started as early as 17th of May to now come forward right up to the 24th of October to come forward for a J&J booster. There is also additional information that is said by SAPRA. You can mix and change, but for now the minister is saying, no, let's err on the caution of waiting for the advisors of the scientists. If you are given a J&J vaccine, you'll be boosted with the J&J. If you are given a Pfizer, you will be boosted with the Pfizer until we get a better and another advice in January next year.
Dinangwe Pelesi, masibonga isikhathi sakho. Dr. Sibongiseni Dlomo is the Deputy Minister of Health, confirming that with immediate effect, contact tracing, quarantining and isolation protocols have been revised.